Cardiovascular disorders that may develop during pregnancy, clinically are termed as peripartum cardiomyopathy, is a rare condition. It is when the heart failure develops in the last month of your pregnancy or within 5 months after your delivery. Now, the cause of peripartum cardiomyopathy remains unknown. Hello and welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I am going to discuss about the diagnostic biomarkers that point out to cardiovascular disease during pregnancy period. Cardiovascular diseases is the first cause of indirect maternal mortality. The diagnosis of such diseases during your pregnancy period is one of the challenges experienced in the clinical practice, just because of the fact that symptoms of normal physiological changes that develop during this period can be overlapping with the cardiac disease-related symptoms. Emerging role of novel and traditional biomarkers in the diagnosis and risk stratification of pregnant women with cardiovascular diseases are needed to raise the standard of care and even optimizing the management of such heart diseases. Biomarkers that reliably distinguish women at high risk for complication would provide a novel biomarker-guided management approach as well as a risk stratification strategy. Now, the roles of cardiac biomarkers during pregnancy remain a topic of interest and make a significant investigation with large sample size study that was recently reviewed and published in the International Journal of Cardiology. In the era of moving towards prevention of cardiovascular diseases more than focusing on the management of established events, biomarkers can be used to predict the new incidence of cardiovascular diseases, or rather predict the outcomes of the previously established cardiac events. Now, if I talk about pregnant women, the NT-proBNP is useful for diagnosis, prognosis, as well as risk stratification to exclude heart failure. Now, the NT-proBNP level at 20 weeks of gestation is considered a predictive factor for cardiac events during pregnancy. Depending upon such data, the enrollment of pregnant women in clinical trials and researches can be encouraged to identify biomarkers profile associated with different cardiovascular diseases to be used in risk stratification for future prevention of such events during pregnancy. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.